My next question is, I just wanted to ask you, what's your favorite thing about orthopedic surgery?
It might be different for different people, but I gotta say, I really enjoy being in the middle of a big trauma case where I'm collaborating with 4 or 5 other physicians, and we're talking to the general surgeon, and we're talking to the anesthesiologist, and we're making a plan with plastics, and all these pieces of the puzzles are moving. And it's not something that you could plan for because every trauma is different. So you got to think on your feet, you got to collaborate, the adrenaline's pumping, and we don't always get a good outcome, but when you get a good outcome, and we're getting pretty good at making sure we get good outcomes, it's one of the most intrinsically satisfying aspects of medicine. I think there's nothing better than having a whole team come together to really look after someone when they're an extremist and seeing them walk through 6 months later after they're recovered from the injury and they're back on the mend. It's a pretty rewarding aspect of medicine.
And is there anything that you don't like about orthopedics?
I think it's a good question. I think the challenge about orthopedics is that there's lots of different versions of it, right? So, for example, I'm an academic orthopedic surgeon. So part of my job is to be a professor or an assistant professor at the University of Toronto. And while I love teaching and I love being part of teaching, it comes with a lot of other responsibilities. There's a lot of committee meetings. There's a lot of evaluations to fill out. There's a lot of reports that have to be done. There's a lot of grant applications that are due. And those things can sometimes seem like they take away from what you signed up for. And we signed up for surgery. We like being surgeons, and that's part of the fun. And for me, sometimes that kind of weighs upon all my responsibilities, but I understand it's an important aspect that has to be done. And I guess that would be my biggest gripe as an academic surgeon. The flip side of that is when I talk to my community guys, they have to go in and around on the weekend because they don't have a resident or a fellow to help them. And I'm really lucky that I have great team members in terms of senior residents, junior residents, and fellows, and they provide a lot of help in terms of running my practice. So it's kind of a give and take relationship.